Good morning, one and all. Myself, Dr. Rupasri. Today, we are going to discuss a small topic that is subjective symptoms of first trimester. Students will be having some difficulty that what are the subjective symptoms, what are the objective symptoms. Okay, subjective symptoms means these are the symptoms which are said by patient itself. Patient will come and say, doctor, I'm having so and so problem, I'm having so and so symptoms. Those are subjective. Objective means those are identified by the doctor. Okay, though in screening test or in lab investigations, those are the objectives. Okay, objectives. And only subjectives means it is said by patient itself. Okay, first we'll calculate what is the duration of pregnancy. How much is the duration of pregnancy? This is the most important questions. We will be seeing so many papers. Okay, in duration of pregnancy also, the gestational age will be according to the menstrual period, that is known as menstrual age. And sometimes there will be fertilization age or ovulatory age. Okay, what is the menstrual age or gestational age? See, it is from the first day of last menstrual period. We always calculate the menstrual age or gestational age as first day of the last menstrual period. It is 9 months plus 7 days, okay, or 40 weeks or 280 days. Okay, according to this only we will calculate the expected date of delivery. So menstrual age and gestational age, it is 9 months plus 7 days or 40 weeks or 280 days. And now fertilization age means fertilization will be taking place 14 days prior to first day of last menstrual period. Therefore, we'll calculate it as 280 minus 14 days. It is about 266 days. This is seen in the artificial reproductive techniques or when the dates are calculated by the embryologist or reproductive will be there, no artificial reproductive techniques that will be there here. Okay, it is 266 days. So they'll be asking according to the menstrual age or gestational age, how you will be calculating means 9 months plus 7 days, 40 weeks or 280 days. Then how you will be calculating from the fertilization or the ovulatory age means it is about 266 days. Okay. The questions will be like this only. You will be seeing what is the menstrual age, what is the fertilization age, how you will calculate the fertilization age, why 14 days are reduced because ovulation will be taking this 14 days prior to the first day of the last menstrual period. Okay. Now next. Now we'll come to the symptoms. First sign. That is first thing the patient will be coming to the hospital and saying that, Madam, I'm having amenorrhea. Amenorrhea since 2 months. Amenorrhea means missed periods. Why I'm saying this much detail because so many students will be having confusion regarding the terms, exact definitions, exact signs and symptoms. So I'm explaining it in a short manner. Okay. So patient will be coming and saying that I'm having a missed period since 1 month or 2 months. Okay. Now sometimes what will be happening is even in the period of amenorrhea also there will be bleeding up to 12 weeks until the decidual space is obliterated. How it is obliterated means how it is obliterated by fusion of decidua vera with decidua capsularis. See in the image, this is the decidua vera. See, and see the decidua capsularis, this one. Okay. Until the fusion of this decidua capsularis and decidua vera, there will be some amount of bleeding. Will be a little clear. There will be some amount of bleeding. This is known as placental sign. Okay. This bleeding is known as placental sign. Now the third point. Sometimes this placental sign can also be differentiated from threatened abortion. We should be careful whether we should identify whether it is a placental sign or a threatened abortion. It will be mostly up to only 12 weeks. After 12 weeks, nothing will be there. Okay. See, what are the questions they will be asking is, what is the sign or symptoms given by the patient to confirm it as pregnancy? First one is amenorrhea. What is the placental sign? They'll be asking in the viva, or they'll be asking in the short note of 2 marks. What is a placental sign? Okay, these two are the important questions. How the placental sign should be differentiated? From what it should be differentiated? It should be differentiated from threatened abortion, because both will be similar. If the patient is complaining of amenorrhea in the reproductive age, if she is about in the reproductive age from 18 years to 30 years or 35 years, then what we should rule out first? We should rule out pregnancy. Okay. Next. What is this morning sickness? Patient will be complaining of nausea and vomiting. Okay. Right from missed period. That is from the missed periods up till 12 to 14 weeks. She'll be complaining of severe nausea and vomiting. Why this happens? Why it is present in the first trimester itself? It is mostly because of the increase in the hormones like HCG and estrogens and progesterones. We will discuss detailedly regarding this morning sickness or the vomiting in pregnancy in the coming videos. But what is the important reason for morning sickness is this, because of the rise of the hormones like HCG, estrogens and progesterones. It will be up to 12 to 14 weeks. Okay, why up to 12 to 14 weeks? Because HCG will be maximum up at 60 to 70 days. Highest. So at that time, more amount of morning sickness will be seen in the women. What are the questions they will be asking in this slide are, morning sickness from when to when? That is from which period? When will it stop? Means about 14 weeks. And why the morning sickness will be there? What is the major hormone that is responsible for it is HCG, beta HCG. Next. As I already discussed in the previous slides, see what I have discussed, the breast changes are most commonly seen in primigravida who has never lactated. If there are any secretions from the breast, in the reproductive age group, pregnancy should be ruled out. Okay, and in pregnancy, patient complains of pricking discomfort and pricking sensation because of enlargement of ducts alveoli, because of increase of estrogen and progesterone. Okay, so Breast changes. What you will be seeing in the breast, that is, see, mostly the changes are seen in the primary gravida. From first time seeing, in the previous video also I have discussed detailedly regarding the breast changes in pregnancy. Please see that video also and what are the questions covered in that video. And if there are any secretions from the breast, from like colostrum or milk secretions will be there, then pregnancy should be ruled out. And secretions from the breast will be starting from 12 weeks itself. Okay, why the patient complains of pain, pricking sensation, or any discomfort in the breast? Because of the enlargement or division of the ducts alveoli, because of the estrogens and progesterones. Okay, next. Patient will be complaining of increased frequency of mixturation. Why? Why? I am discussing it in detail. Only small video, but correct reasons and explanations. Why it happens is the most important thing, and you will remember more by remembering the reasons only. Okay, and you'll be answering more. Why the frequency of mixturation? Because first one, bladder. What happens is the gravid uterus rests upon the fundus of the bladder. First point. Okay, as you all know, the bladder will be like this. Okay, and the uterus will be like this. Uterus and the bladder. As a pregnancy is confirmed, bladder will be like this, and the uterus goes on increasing, and this will be resting upon the bladder. Therefore, the gravid uterus rests upon the fundus of the bladder, and it leads to the increased frequency. Next is bladder mucosa get congested because of the increased vascularity and all. So gets congested and hypertrophy. Okay. Third is in pregnancy there is osmoregulatory changes. Changes leading to polyuria and thirst. Polyuria and thirst. As after the 12 weeks or first trimester. First trimester is up to 12 weeks. Some will be saying up to 14 weeks also. Okay. It may be up to 12 or 14 weeks. First trimester. All these changes are decreased. And the frequency of mixturation comes stabilized. And the frequency of mixturation is stabilized. Again, it will be observed in the third trimester. Okay, we'll see this next changes there itself. Okay, what are the important questions they can be asking? See, each slide I am taking about 3 to 4 important questions and explaining it. Okay, what are the important questions? They'll be asking, what are the reasons for increased frequency of mixturation in the first trimester? Which is, gravid uterus will be resting upon the fundus of the bladder. Okay, fundus of the bladder, and the bladder mucosa will get hypertrophied or congested because of the increased vascularity. There will be osmoregulatory changes in the pregnant woman. It leads to polyuria and thirst. All these changes will be observed up to 12 to 14 weeks, and later on it will get stabilized, and then these similar changes can be seen in the third trimester. Okay, these are the only the subjective symptoms and the specific reasons why the patient is complaining so and so. Okay, I think it will be helpful to you all, and you'll be remembering the reasons and answering the questions well. Thank you.